Greetings, health enthusiasts. Welcome to Doctor NGUYEN's YouTube channel, your trusted source for health information. Today, we're turning the spotlight on a crucial aspect of our well-being, our hearing. We'll be exploring the realm of hearing loss, diving into its causes, symptoms, diagnosis, and various treatment options. We'll also shed light on non-medical treatment alternatives, potential complications, and preventative measures. So, let's tune our senses and get ready to delve deeper into the world of hearing health. Stay tuned. Hearing loss is a common condition affecting millions worldwide. It's a challenge that touches lives in every corner of our planet, transcending age, race, and social status. Hearing loss isn't simply about losing the ability to hear sounds, it's about the loss of connection, the loss of the full experience of life. It's about missed conversations, misunderstood words, and the silent retreat from social participation. Every day, in every language, people are straining to hear, struggling to communicate, and often suffering in silence. But it's not all doom and gloom. Advances in science and technology are bridging the gap, reconnecting people with the world of sound. The impact of hearing loss is far-reaching, but so too is the potential for change. By raising awareness, promoting early detection, and supporting those affected, we can turn the tide on this silent epidemic. Understanding hearing loss begins with understanding its causes. There are several potential causes of hearing loss. One of the most common triggers is exposure to loud noise over extended periods. Think of those rock concerts or constant use of earphones at high volume. These can damage the delicate structures inside our ears. Aging is another significant factor. As we grow older, the tiny hair cells in our inner ear that help us hear begin to break down and can't pick up sound vibrations as efficiently. Certain health conditions can also contribute to hearing loss. Conditions like high blood pressure or diabetes can affect your hearing. Infections or abnormal bone growths or tumors in the outer or middle ear can block sound too. Some medications, known as ototoxic drugs, may harm your inner ear. Even genetics play a role. Some people have a genetic makeup that makes them more prone to ear damage. Now that we know the causes, let's move on to identify the symptoms. Hearing loss can manifest in different ways. While some may experience a gradual decline in their hearing ability, others might notice a sudden and significant change. Regardless of how it surfaces, it's crucial to understand the symptoms and how to diagnose this condition. The first symptom many people notice is a difficulty in understanding words, especially against background noise or in a crowd. Conversations may seem muffled, and you might find yourself frequently asking others to speak more slowly, clearly, and loudly. Another common symptom is frequently turning up the volume on your television or radio. If you constantly need to increase the volume to a level that others find too loud, it might be a sign of hearing loss. Tinnitus, a ringing, buzzing, or roaring in your ears, is also a common symptom associated with hearing loss. This can occur in one or both ears, and it often comes and goes. However, for some, it can be continuous and quite annoying. Now let's talk about diagnosis. If you notice any of these symptoms, it's important to consult a healthcare professional. They can conduct simple tests to determine if you are experiencing hearing loss. The most common diagnostic test is a pure tone audiometry test. This involves listening to sounds at different volumes and pitches in a quiet environment. Another test is the speech audiometry test, where you'll listen to and repeat words at different volumes. This helps assess your ability to hear and understand speech. In some cases, a tympanometry test might be used. This test measures the movement of your eardrum in response to changes in air pressure, helping to identify any issues with the middle ear. Audiologists also use otoacoustic emissions, OAE tests. These measure sounds given off by the inner ear when stimulated by a sound. If these sounds are absent, it can indicate damage to the hair cells in your inner ear, a common cause of hearing loss. Once diagnosed, it's time to explore treatment options. Treatment for hearing loss varies based on its cause and severity. It's a statement that resonates with the complexity and individuality of our auditory health. Let's delve into the world of medical and non-medical interventions that can help manage hearing loss. In the realm of medical treatments, hearing aids are often the first line of defense. These small devices amplify sound, making it easier for people to hear. They come in various styles and sizes, from those that fit snugly inside your ear to others that sit comfortably behind it. It's a solution that caters to different types of hearing loss and lifestyle needs. For more severe cases, cochlear implants might be considered. These electronic devices bypass the damaged part of the inner ear and directly stimulate the auditory nerve. Unlike hearing aids, which make sounds louder, cochlear implants can enhance sound clarity, potentially opening the door to a world of sounds previously inaccessible. Now let's transition from the medical to the non-medical. Speech reading, also known as lip reading, is a skill that can be honed to complement hearing aids or cochlear implants. It involves focusing on a speaker's lips, facial expressions, and gestures to understand their message. It's like piecing together a puzzle, where each element adds context and meaning. Sign language, another non-medical intervention, is a complete and complex language that employs signs made with the hands, facial expressions, and postures of the body. It's not just a tool for communication, but a cornerstone for the culture and community of the deaf and hard of hearing. Lastly, assistive listening devices like amplified telephones and flashing or vibrating alarm clocks can make everyday life more manageable. These devices are designed to make specific sounds louder, clearer, or more noticeable, empowering those with hearing loss to navigate their world with confidence. While treatments can help manage hearing loss, complications can arise. But remember, every journey towards better hearing is unique. It's about finding the right combination of treatments and strategies that work best for you. Hearing loss can lead to complications if left untreated. It's more than just a nuisance. It's a condition that can significantly impact one's quality of life and even lead to other health issues if not properly addressed. One potential complication is social isolation. It's not uncommon for individuals with hearing loss to withdraw from social activities because they struggle to communicate and keep up with the conversation. This isolation can lead to feelings of loneliness and depression, creating a vicious cycle of emotional distress. Cognitive decline is another serious concern. Several studies suggest a link between untreated hearing loss and cognitive impairment, including conditions like dementia. The theory is that the brain may have to work harder to process sound, leaving less cognitive resources for memory and thinking. The social isolation that often accompanies hearing loss can also contribute to cognitive decline, but it's not all doom and gloom. There are ways to prevent, or at least slow down, the progression of hearing loss. One of the simplest methods is to protect your ears from excessive noise. This means turning down the volume on your music and television, wearing earplugs at loud events, and taking regular breaks from noise when possible. Regular hearing checkups are also crucial. Just as you would go for a yearly physical or eye exam, it's important to have your hearing tested regularly. Early detection of hearing loss can make a world of difference in managing the condition and preventing further damage. A healthy lifestyle can also help. Regular exercise, a balanced diet, and adequate sleep all contribute to overall health, including the health of your ears. Avoiding smoking and limiting alcohol consumption can also reduce the risk of hearing loss. So remember to take care of your ears just as you would any other part of your body. Protect them from excessive noise, get regular checkups, live a healthy lifestyle, and seek treatment if you notice any changes in your hearing. Remember, prevention is always better than cure. It's been a comprehensive journey exploring hearing loss. We've delved into its causes, symptoms, and diagnostic methods. We've looked at treatments, both medical and non-medical, and discussed complications and prevention strategies. The importance of early diagnosis and treatment cannot be overstated, as it can significantly improve quality of life. Thank you for joining us today on Dr. Nguyen's channel. Remember, your hearing health matters. Until next time, stay healthy.